Good evening and welcome. I'm Jillian Kumagai, and I'm the Director of Stanford Health Library and Community Outreach. Thank you for joining us for our talk tonight on fatty liver disease. It's my pleasure to introduce our speaker, Dr. Randall Stafford. Dr. Stafford is a professor of medicine at the Stanford School of Medicine and the director of the Program on Prevention Outcomes and Practices. In addition to his research focus, Dr. Stafford is a primary care physician in the Stanford Internal Medicine Clinic, where he focuses on chronic disease prevention and treatment. Throughout the talk, please enter any questions in the Q&A box at the bottom of your screen, and at the end of the talk, Dr. Stafford will answer as many of those as possible. Dr. Stafford, I'll turn it over to you.
Thank you very much, Jillian, and it's great to be here. I'm going to go ahead and share my first slide here. I wanted to welcome everybody here. I think we're going to be having more people join as we go along, but it's really my pleasure to be in the Stanford Health Library today to talk about liver and both the idea of keeping your liver healthy, but also living better with fatty liver disease. And without further delay, I'm going to get into my talk. And this is a big topic, so there's lots of things that we could talk about. I'm going to focus on a few kind of interesting elements of this, but please go ahead and ask questions within the chat. So to start out, I think we all know where the liver is. It's in the abdomen, at the top of the abdomen, over to the right side of our abdomen. And this is just a depiction of the liver in relationship to some of the other organs, including the lungs, which are above it, the pancreas, the stomach, the intestines, and then kind of tucked behind the liver is the gallbladder. So I'm not going to give you a lot of information about, the physiology and anatomy of the liver, but I think it's important to just locate it within your body. Some of my objectives today. So a lot of this information you can get by doing your Google search. I'm really intent on providing you with a perspective that you won't find, that may not be so easy to find through just searching the internet. I want to describe a few things about what the liver does to really make you realize what an amazing and, in some sense, taken for granted organ it is. I'm going to discuss what can go wrong in the liver, especially with what we call fatty liver disease. And then also talk about this concept that there's a common pathway for the progression of liver disease, that the liver tends to respond to inflammation in a way that leads to fibrosis, leads to cirrhosis, and then leads to cancer, regardless of what the initial cause of the inflammation was. And I'll go back and define some of these terms, so don't worry. One of the bottom lines of my talk is that keeping your liver healthy is really no different than what we should all be doing to keep our whole bodies healthy. And the way that we treat fatty liver disease really should be relying on changing our health behaviors to lead to better metabolism, lead to less inflammation in both our body and in the liver in particular. And I also want to kind of touch on what I think healthcare and medicine gets wrong about the liver, and how we maybe should think about liver health in a slightly different way. So what does the liver do? The liver does a whole long list of things, and I had to work hard to shorten it to this small list here. Yeah, you could go on for many pages of different things the liver does, but a couple of the really important ones, it plays this role in digestion, both by producing bile that helps absorb fats, also by making sure that the nutrients we ingest and that are picked up by our intestines come to the liver for sorting. And there's also an important function of the liver in taking what might be thought of as waste products from the gut, which include cells in the gut that slough off and also bacteria in the gut, and basically reclaiming those nutrients for the body. The liver has a vital role in metabolic regulation. That is how our body continues to have energy to use, not just for keeping the body running, but also letting us do things like walk and talk and ride our bikes. This is really important when it comes to maintaining blood sugar. And the liver works closely together with the pancreas, the muscles, and the fat in our body. The liver is also amazing in detoxifying our bodies of poisons that we're exposed to. And it does this either by excreting these in bile or by modifying some of these toxins chemically. The liver can also be thought of as a red blood cell clearinghouse. It's really important to be able to use the iron that's contained in red blood cells that are dying, that have reached the end of their 3-month lifespan, and to be able to put that iron back in new red blood cells. And that's a function that the liver does and does exquisitely well with. And then also the liver is important for storing energy, being able to take glucose and convert it into glycogen, but also doing the reverse. So when we need it, taking that glycogen and converting it back to glucose. The liver also has this major function as the main factory of the body, manufacturing things like proteins or some types of lipids. Our ability for our blood to clot is completely dependent on proteins that are manufactured in the liver. And essentially, it's important to remember that everything you put into your body goes through the liver. And, when I was preparing this talk, it brought me back to kind of how exciting some of this stuff is. And some of this stuff was when I was first learning about medicine. And, just one example is the way in which the liver gets rid of bile as a toxin at the same time as using that bile to help absorb fats. So this is a little bit like having a gray water system in your house. It's really clever how we can take a waste product and then make good use of it for, let's say, watering gardens. In terms of liver terminology, there's a lot of terminology that people throw around when we're talking about the liver. And a lot of this is pretty simple when it really comes down to it. So I've kind of put the leading terminology that comes up in talking about the liver. The liver is built of these lobules, and these are the essential basic unit of the liver. And some people have talked about these lobules as kind of the neighborhood of liver cells or hepatocytes. And these neighborhoods are kind of built around two types of freeways. The freeways that carry blood back to the rest of the body, and then these freeways that are carrying blood into the liver and also bile out of the liver. So it has this very interesting geography or architecture that helps it do what it does. Bile is produced in the liver. It's usually stored in the gallbladder and then released into the intestine after we've eaten a meal that contains a lot of fat. And bile is one of the kind of key things that the liver does, but only part of what it does. Hepatitis is just a general word for inflammation or irritation occurring in liver cells. And when those liver cells are irritated, they generally function to some degree, maybe not as well as in the absence of irritation, but what's most important is what happens after inflammation. That is, if inflammation is allowed to continue for long enough at a high enough level, there is a likelihood of two things happening. First, fibrosis, which is essentially early scarring that forms in reaction to inflammation in the liver. And then cirrhosis. Cirrhosis is kind of a second stage where the scarring becomes heavier. It more drastically reduces the function of the liver. And some parts of liver function are affected more easily than others. And one of the parts that happens even before we get to fibrosis is this idea of fatty liver, or what's often called steatohepatitis. And this fatty liver is essentially trapping of fat within or near these liver cells so that they store liver in a way that they're not really supposed to do. And this process I'll talk about in a little bit more detail, but essentially it's important to realize that fatty liver has a very close relationship to diabetes. Also, you may hear the term hepatocellular carcinoma. This is referring to a malignancy or cancer of the liver cells, the hepatocytes. And then finally, I'm not going to talk about it, but one of the really clever things in terms of how the liver has evolved is that it has a second blood supply. It has what's called a portal circulation, which means that blood that is coming back to the body from the gut, from our intestines, hits the liver first before it hits the rest of the body. And this is, I think, an advantageous way of dealing with nutrients and toxins that come into our gut, because in some sense, the liver sees all this and can manage all this before it allows those nutrients to get to the rest of the body. So just a very quick kind of run through some of the tests for assessing liver function. You know, by far the most important that I order are these tests called transaminases, which are often abbreviated as AST and ALT. These, when we measure these in the blood, essentially what we're measuring are these enzymes leaking out of liver cells. And healthy liver cells will leak just a little bit of these enzymes, these transaminases, into the bloodstream. But to the extent that the liver cells become leakier, we see more of these compounds accumulating in the blood, indicative of irritation within those liver cells. So this is a very important, kind of test here. Three other types of tests are alkaline phosphatase, bilirubin, and albumin. These measure different things in terms of what the liver is doing. So the first, the alkaline phosphatase, measures irritation of the bile ducts in liver, and sometimes has different causes than elevations in the AST and ALT. Bilirubin is a sign of congestion in the liver sewage system. Essentially, the exit of bile from the liver is being held up, and bilirubin therefore leaks, much the way that these enzymes do, into the bloodstream. And we find that a blood test can measure this compound that really, by and large, should be kept within the liver, within the gallbladder, and into the intestine. And then finally, there are a few different tests that might measure what we call the synthetic capacity of the liver. That is the ability of the liver to keep manufacturing the things we need to live. And so, for instance, the prothrombin time is a measure of blood clotting. And to the extent that the liver is making enough of these clotting factors, this prothrombin time will be normal. There's also some imaging tests that I want to just mention briefly. The first is using ultrasound to look at the liver. These are sound waves that essentially are bouncing off the liver tissue, coming back to a sensor, and then being put together in such a way that we can take a look at what the liver looks like. And this strategy is very helpful in terms of distinguishing normal liver which is very much filled with water and has a look on it in the ultrasound, compared to fatty liver, which is much more, the fatty liver looks much less regular, and the fat has a different look to it when it's hit by the ultrasound. And there's also a new test, which essentially is measuring how bouncy the liver is. Normal liver should be jelly-like and should bounce around. When the liver starts to become irritated and starts to deliver fatty liver, the bounciness declines. And it declines even more to the extent that scarring occurs within the liver. And then CT and MRI are two very useful technologies for really examining in fine detail what the liver looks like. And these are going to be very important, for instance, in trying to detect liver cancer or metastatic cancer that ends up in the liver. And then finally, tissue biopsy is another option. And this allows us to look under a microscope at the liver cells themselves and how they're related to other cells, looking at essentially the geography of these neighborhoods within the liver, and also the presence of intruders. Are there cells that usually shouldn't be present in the liver, particularly inflammatory white blood cells, that tell us things about what's going on within the liver? But again, from a viewpoint of a primary care physician, the first two tests that I measure up there are by far the most important ones. So there are lots of things that can hurt the liver. And when we think about liver disease, we're really talking about a certain set of conditions that can irritate the liver and begin this process of the liver becoming injured and, in many cases, progressing on to more serious types of liver disease. So one big area are toxins. And of course, in our society, alcohol is a ubiquitous toxin that we expose ourselves to with harm to our livers. There are many other toxins as well, and things like the amanita mushroom, which very readily causes liver failure, or things like overdose of Tylenol or acetaminophen. And, these are an important source of liver disease, particularly because alcohol use is so ubiquitous. Many infections also can cause a irritation of the liver, particularly hepatitis A, B, and C. These are all caused by different viruses that can affect the liver. In terms of long-term liver disease, B and C are the most important. But other viruses can also cause liver irritation, even COVID-19. What I'm going to focus on mostly today is this idea of metabolic dysfunction. The idea that as our body becomes less regulated around how it deals with carbohydrates, the liver takes a brunt of the blow by developing fatty liver disease, often in the context of diabetes, but not always. And one important idea is that fatty liver disease is closely related to diabetes through this mechanism of insulin resistance, which I'll talk about in a moment. I should also mention a couple of other important causes of liver problems. Because the liver is so large, it's particularly prone to traumatic injury, whether this is through motor vehicle accidents or, let's say, gunshots. And then cancer can affect the liver. not only the cancer of the liver cells, but because the liver is dealing with all of these functions and needs to basically see all of the blood in the body, it is a frequent site of cancer metastasis from cancers that start somewhere else. So in terms of this idea of liver disease, one of the key concepts we have is this idea of a common pathway, that healthy liver usually goes through these stages. And some of these stages take years or decades to develop. But in many ways, the idea is that liver disease is progressing from healthy liver to fatty liver to fibrosis to cirrhosis, and then on to cancer. Not everybody who develops fatty liver is going to progress all the way to cancer. In fact, it's a vast minority that do. But the idea is that each of these stages kind of comes about because of damage created in the previous stage. And the interesting thing is that it doesn't really matter that much about what's causing the damage to the liver in the first place. And one of the important messages I'm going to try to get across is whether it's from alcohol or from metabolic problems, fatty liver disease is itself a problem, and a problem because it can progress to these more serious forms of liver problems. Now, I want to talk a little bit about fatty liver disease. On the right here, I'm sorry, the left here, we have a depiction of a normal liver. You can see that it has a smooth surface and is, in general, kind of the same homogeneous color. It's usually a reddish purple. As the liver begins to take in fat, it changes color. Literally, fat, which is yellow, colors the liver yellow as well. So we have a depiction on the right side of fatty liver, and you can see that there's more differences in terms of how it looks. It's no longer as smooth as it once was. And the fat may be accumulating more in some areas than another. And what's not shown here, of course, is the damage that's being done at a cellular level in terms of the irritation or inflammation within those liver cells. Now, I want to get across this idea of insulin resistance. And this is what makes fatty liver part of a cluster of conditions which are linked to diabetes and to heart disease. But the idea is that insulin resistance is when the body is in such a state that a given concentration of insulin doesn't have the response that it is desired. So insulin is released when our blood sugar goes up. And by secreting insulin, the pancreas takes a high blood sugar, and basically is telling the body, you need to get rid of that sugar. You need to bring that sugar down by putting it in muscle and in the liver. When the insulin doesn't have the expected effect on reducing blood sugar, the pancreas spits out more and more insulin. And this problem, often called insulin resistance or metabolic syndrome, really means that the body has, to some degree, lost control of being able to regulate the amount of sugar that is circulating in the blood. And I just wanted to point out that, these are all interrelated, that blood pressure goes up, that this is often associated with excess weight or obesity. Blood sugar goes up, triglycerides, part of the liver, the lipid panel goes up, and HDL, the so-called good cholesterol, goes down. All of these things happen at the same time, and quite often the liver is also taking a blow as it starts to develop fatty liver disease. And just to talk a little bit more about kind of cardiometabolic disease, the idea is that insulin resistance is occurring at receptors in the body, receptors that are in muscle, liver, and in fat tissue, adipose tissue. And when there's insufficient clearing of blood glucose, the pancreas spits out more insulin. And to the extent that insulin goes up, it causes these problems with macrovascular and microvascular damage, both from high insulin levels and high glucose levels. In some ways, the liver is often left out of these discussions, but it's a really important part of insulin resistance. Now, it's important to say that, diabetes can exist without fatty liver, and fatty liver can exist without full diabetes. But these are closely related concepts, and this is directly tied with how we think about improving liver health and trying to reverse fatty liver disease. One of the really important factors is extra weight. And we have this measure called the body mass index, or BMI, which is a measure of fatness. And, there's a little bit of detail here, but, the basic idea is that as we get fatter, as our BMI goes up, our chance of developing fatty liver goes up, just as our chance of developing diabetes goes up. And in terms of BMI, there are kind of two different sets of numbers for thinking about BMI. For people who are not of Asian ancestry, whether they're of African or European ancestry, we have one set of numbers. And you can see that as the numbers go up, we go from normal to overweight to obese. And for those of Asian ancestry, we actually know that for a given BMI, they are more likely to develop insulin resistance, develop fatty liver, develop diabetes. So you can see here that the Asian specific numbers are a bit lower than those for other people in the population. And I do want to just recognize that we've put a lot of effort in the healthcare system into measuring and using BMI, but it's not necessarily the perfect measure of body fat distribution. And that we also need to be concerned about where fat is deposited, and particularly this distinction between an apple-shaped fat pattern, where the fat is within our bellies or within the liver specifically, or this pear-shaped pattern of fat distribution, where there's a lot of subcutaneous fat that is mostly on the hips and thighs. The apple shape is far worse and far more likely to be associated with fatty liver disease. So I wanted to kind of just get to this idea of how is liver health mismanaged? And there's a couple of things that often you hear from other doctors, particularly from liver experts or hepatologists, that I think aren't quite the way we should be thinking about liver health. The first is that we can't really separate liver health from other general prevention strategies. And the things I'm going to talk about in terms of keeping your liver healthy are the very things you should be doing to keep your whole body healthy. And the other thing is that it's often said that fatty liver disease is is a untreatable condition. It really isn't. And again, through thinking about prevention and thinking about what we do to reduce our risk of other diseases like cancer or heart disease, we actually already know how we should be approaching fatty liver disease. Also, in the medical literature and in some discussions with patients, there's often a big attempt to separate fatty liver disease that's from alcohol and fatty liver disease that's not from alcohol. And in fact, one of the leading terms is non-alcoholic steatohepatitis, or NASH. I'm going to argue that some of this distinction really doesn't make as much sense as sometimes we give it credence for. And part of this is that the role of alcohol is really underappreciated. And I have a few slides where I want to really go over the issue of alcohol, because in some sense, I think we've bought into a certain mythology in our society about alcohol and this whole concept of safe level of drinking. And then I also want to say that some of the diagnostic approaches, even the need for a biopsy, may not help us quite as much as some people think. And in particular, some of the diagnostic strategies don't necessarily give us any further guidance on how we should be treating fatty liver disease. So in terms of treatment strategies, these are really the kind of things that you've heard from many other people. And I'm going to tell them to you again because they're so important. But I think the bottom line I have is that these are important for liver health. And these include weight loss, a DASH type, Mediterranean type, or predominantly plant-based diet. Physical activity is critical. Even without weight loss, the body responds to physical activity by becoming better at utilizing blood sugar. Lower alcohol intake is really an important strategy that I don't think gets talked about as much as it should. Stress reduction and sleep improvement. In some sense, all of these strategies are what I would call anti-inflammatory. If you do these, the amount of inflammation in the body, and often within the liver, is reduced. And that includes, sleeping better. Sleep deprivation leads to metabolic problems that in turn lead to irritation in the liver. And what do we mean by chronic inflammation? Well, we're really talking about chronic, sustained activation of the immune system in a way that isn't helpful in doing what the immune system is supposed to do, which is essentially recognizing intruding microorganisms and dealing with them. So when our immune system is activated, we have this process of inflammation. The liver, being so central to how the body works, is often one of the sites where inflammation is evident. And there, as I just said, there are multiple health behaviors that influence systemic inflammation. We can downregulate inflammation through things like physical activity, better sleep, social interaction, more fruits and vegetables, weight loss, even things like meditation. And then on the other hand, the flip side is that we can make inflammation worse by being sedentary, depriving ourselves of sleep, being isolated from others, eating a diet high in processed carbohydrates, saturated fats, and trans fats. All three of these are bad. Gaining weight, and then psychological and social stress in our lives. And I want to get across this idea that not only is inflammation tied to liver disease, but it's really intimately tied to the development of high blood pressure, atherosclerosis or heart disease, cognitive decline, and diabetes as well. And when I talk about health behavior change, I just want to kind of give you just a little bit of a warning that it really is a complex process, and that, we all wish that changing behavior was like a light switch. We could turn it on and we could turn it off, but it's not that simple. And it does take hard work. And I'm not gonna, sit here saying that these are easy solutions to liver disease, but they are the things that work. And we need to focus on small goals and accumulate them over time. When I talk about these health behaviors, it's very easy to feel overwhelmed and say, wow, there are so many things I could work on. But the idea is to focus on a small goal and be successful with that goal. There's often a need for social support around making behavior changes, whether it's in your diet, in terms of alcohol intake or physical activity, or these other behaviors I've mentioned. There's no right time to start a behavior change. And often we wait around thinking, well, I need to wait for the right time to be more physically active. Well, the fact is there is no right time, and we shouldn't wait and put off doing something that's important until we feel more ready, because often we don't really ever feel fully ready. Also, this idea of picking priorities. We want to really pick those behavior changes that are going to have an impact on outcomes. For instance, that really do help the liver become less inflamed. We also need to think about what's our level of readiness for making these changes. Is this something I can easily do to get started, or do I really have to, kind of plan this out over a long period of time, or maybe split it up into multiple steps within a larger change? Also, we need to think about our ability to maintain changes. And I want to just put out this idea that sometimes making the initial changes is actually easier than maintaining those changes over time. And I want to just get kind of make a statement that we all need to be self-compassionate in pursuing behavior change. These aren't changes that are easy to do. Often it's a matter of taking 2 steps forward and then having a step back. So we need to be easy on ourselves and recognize that it's in the nature of behavior change to have these frustrations, and not let these frustrations derail us entirely. I put this up here. I know it may be a little difficult to see the text, but I put this up here to discuss this idea of change behavior having these multiple stages. And one thing that I want to make kind of emphasize is the idea that we go through several internal steps before we ever act in the real world. So we pre-contemplate, we aren't even ready to think about a change. And it's a big step to actually start contemplating a change. And likewise, we can contemplate a change, but we don't really have any idea of how to act. We're not committed to doing anything. So moving from contemplation to a preparation phase is a big deal. And then finally, after all of that, we finally get to act. We start modifying our behavior in the real world. And again, emphasized here is this idea that it's not just the action, it's the maintenance of behavior change over time. So again, there are all these steps that even come before trying to do what we want to accomplish. So this should be not so much a message that it's complicated, but that it takes time. And it's important to realize that jumping too quickly into an action before all these steps may not necessarily be a good thing to do. So I do think that we need to take behavior change seriously and not keep procrastinating, but we also need to give it time and also realize that we'll be more successful on some days than others. So I'm going to go through these relatively quickly because I want to allow some time for questions at the end. In some ways, I'm not telling you anything new here, but what I am telling you is these things you've heard about as good for overall health are clearly very valuable for the liver. So weight loss is an important one. And, I have a number of things written out here, but I really wanted to emphasize this idea. It may not take that much weight loss to actually have a metabolic impact and to reduce the amount of inflammation in the liver. And this is often a really important point because sometimes when I ask people how much weight they want to lose, they say things like, well, I want to get back to what I weighed when I was 20 years old. And in fact, there really isn't a need for massive weight loss. It may take relatively little weight loss to actually have the desired benefit. In terms of healthy diet, there are so many aspects of this, and this could be several hours of a talk, but just the high level is that we need to eat a diet that's high in fruits, vegetables, and whole grains. And, we can have these as goals and aspirations. I often put it, we need to move in the direction of more fruits, more vegetables, more whole grains. We need to move in the direction of less fat, less saturated and trans fats in our diet. And in fact, it's okay to eat non-saturated, unsaturated fats. We need to avoid sugar-sweetened beverages when we can, and eat a plant-predominant diet that's high in fiber. We need to also think twice about how much processed or packaged foods we allow into our diet. And then, as I mentioned before, a couple of important kind of starting places are these diets called a Mediterranean diet or a dietary approach to stop hypertension, or DASH. In terms of physical activity, what I want to let you know here is that it's not enough to just engage in aerobic physical activity. And of course, aerobic physical activity is large muscles being moved repetitively so that our heart rate increases. We're doing mechanical work when we're doing aerobic physical activity. And the goal optimally should be to have 150 minutes per week of moderate to vigorous aerobic physical activity. And that's a lot. So again, I like this idea of this is our aspiration. We need to start moving towards that aspiration. And then strength training is another important part of physical activity. And it's particularly important as we get older. And this is an important way of trying to keep our bones healthy and preventing falls. But also, as we get older, there's a tendency to lose muscle mass. Strength training, using weights, can really help us reduce the amount of muscle mass we lose as we age. And then I would say the same thing about a third general category of isometric balance core training. This is things like yoga or Tai Chi, Pilates, where we're really contracting muscles to hold the same position. And again, aerobic physical activity isn't enough. It really needs to be all three of these types of physical activity. So I want to talk a bit about alcohol. And, often this topic is framed in terms of what's a safe level of alcohol exposure. And, in some ways, that's a little bit like saying, well, what's a safe level of cigarette exposure? Or, what's a safe level of automobile driving? All of these things are harmful. And each of us personally has to figure out where we can end up to not endanger our health. This is a liver toxin that increases inflammation. Just because it's sold and consumed on a daily basis doesn't necessarily mean it's not bad for us. And we certainly have a lot less restrictions on, things like alcohol compared to some other toxins that we consider drugs of abuse. It's also important to recognize that alcohol works in synergy with other causes of inflammation, particularly those metabolic causes. And while there's a great harm from binging and high intake of alcohol, it's really difficult to identify a safe daily exposure. And I'll show you one example of that in a little bit. Likely the safe exposure is in the range of half a drink a day. And anything above that really is subjecting our body to harm. Now, we make these trade-offs all the time. Getting in a car subjects us to risks as well, as does smoking one cigarette. We have different attitudes towards these three types of exposure, but in a certain way, they're all very similar. For people who smoke, cigarettes are a benefit to them in many ways in terms of stress reduction. Obviously, we rely on our cars to get around. In some ways, we rely on alcohol in social situations as a way to relax. But none of these are really safe behaviors. And there's a lot of mythology about alcohol's benefit. And my own viewpoint is that some of this mythology has really been facilitated and leveraged by the alcohol industry. Now, it is true that there are benefits of alcohol on lipids, the cholesterol panel, and some types of cardiovascular disease are helped by a little bit of alcohol. But by and large, the benefits of alcohol are far outweighed by the harms. And I'll get to that in just a little bit. But I want people to think really carefully about this. And I do want to admit that of all these things that I'm talking about, this is the one that's most difficult for me. I probably should drink a little less than I do. I probably am drinking about, 2 drinks a day on average. It should be less than that, but I find it much easier to get out there and be physically active than reducing my alcohol intake. But it's on my mind. So defining alcohol exposure, a standard drink is essentially 2/3 of a fluid ounce of pure alcohol. And if you did the math, you would see that, a 12-ounce bottle of beer is a standard drink, 5 ounces of wine, a shot and a half of hard liquor. Now, one of the important things is that often when we consume alcohol, we're drinking far more than a standard drink when it comes to how we drink. So for instance, if we think about IPA, a beer-like beverage which often has more alcohol in it, a single bottle is well more than a single standard drink. And the recommendation from the US Department of Agriculture is a recommended level of drinking should be no more than 2 drinks a day for men and no more than 1 drink a day for women. There is a potential for lower recommendations. And if we look at alcohol policies around the world, what we see is gradual reduction in what's considered a safe or a non-harmful level of drinking. And in fact, on average, those people in the United States who do drink alcohol are consuming on average much more than these limits. And these recommendations make it hard on women because they're only half as much in terms of the alcohol recommendations compared to men. Some of that is based on body size, but a lot of it is also based on differences in terms of how alcohol is metabolized in men and women. And then just to go over some of the harmful effects of alcohol, it's really hard to identify many things that are helped by alcohol. And there is this small cardiovascular benefit that is fully outweighed by toxicity to the heart muscle, trauma, that is people getting in accidents or engaging in violence, mental health issues, including suicide, are independently linked to higher alcohol intakes. Cancer risk, whether it's breast, pancreatic, or colon, those are the most prominent, but many cancers are actually increased with the use of alcohol. And liver disease and pancreatitis. And then, some that we don't often think as much about, but maternal and neonatal childhood outcomes are really affected by women drinking during pregnancy. And finally, sexual health, the ability to be fertile, the ability to have erections is actually quite tied to alcohol intake. So one of the issues is, if we think about alcohol intake, we know that very high levels of alcohol intake, like up here, are very harmful. And what this is showing here is that for people who have excess weight or excess weight in their waist compared to their hips, their risk is higher, pretty much twice that of people who are lower weight or in the middle. So we have this big increase up here, but what's notable is that some of the greatest increases in risk actually occur in this range here. And right here this is 10 grams of alcohol per day. That is about 2/3 of a standard drink, or half an ounce of pure alcohol. So if we look at going from nothing to going to a little bit of alcohol, we see this massive increase in risk. And this is the risk of cirrhosis. This is the risk of a very severe scarring in the liver. So based on these kind of graphs, it's really hard to look at this and say, well, if I stay in this range here, which is pretty much the national recommendation, I'm going to be okay, because I'm clearly better off than people up here, but at the same time, I'm worse off compared to people here. So I want to end by just talking about a general prevention strategy. And part of this is basically to say that when we're thinking about liver disease and keeping the liver healthy, we're really talking about the same things that keep us healthy generally. And this shouldn't be a surprise, really, given how central the liver is to our health overall. And same thing can really be said about reversing fatty liver. We need to use these same approaches. And health behavior change really should be thought of as a treatment. Health behavior change isn't just about prevention. It's actually about treating conditions that arise within the body. And in some ways, fatty liver is not the worst thing that can happen because it is reversible. But we need to think about treating it with behavior change, the sort of things I've talked about today, and realizing that some of these things work in concert with one another, that dietary changes have their greatest benefit if they are combined with physical activity and weight loss. The other message here is that these same strategies impact multiple other conditions: blood pressure, heart disease, diabetes, cancer, bone health, cognitive decline, depression, fertility, and many others. So by adopting a liver healthy lifestyle, we're really helping prevent and even treat some of these conditions, for instance, blood pressure. And then I want to go back to kind of how we generally think about liver health. And I want to kind of get it right. And I think part of getting it right is not to see fatty liver as a separate disease, but really to see it as a cluster of insulin resistance related conditions that are created by lifestyle behaviors, and that insulin resistance and alcohol work together. And it's very rare to see somebody who has fatty liver from just one of these causes. And in some ways, the exact diagnosis of pathology may not matter so much, especially when it doesn't change what the treatment approach is. And then finally, often this is called an untreatable disease. And this is a disease that drug companies are investing heavily in trying to find a drug that will treat this. But in some sense, why look so hard for a drug treatment when the strategies are right in front of us? So with that, I want to end up. I think I've left a few minutes, not very much. I'm willing to stay a little late, but would love to get to your questions. And I'm going to go ahead and start looking through some of the questions that you've left already, and see what we can say. So somebody asked about somebody doing this, the elastography, which again is a measure of the bounciness of the liver, and it can be combined into other elements of lab testing to kind of come up with an index. So there is a potential role for that. But on the other hand, we know a lot from the liver based on other blood tests, even before we do that test of bounciness. So I did talk a little bit about stress and sleep. Although they don't get the same attention as things like weight loss, physical activity, and diet, it's very clear that sleep disruption and increased stress or difficulty coping with stress are also inflammatory. So people who work odd hours, who are unable to sleep for various reasons, there is a pattern of that facilitating the development of insulin resistance and of inflammation in the body. So there's one question about, well, what do people actually experience in terms of symptoms based on their stage of liver disease? So first of all, with fatty liver, even though the liver may be growing a little larger than normal, many people don't experience any particular symptoms from that. They may occasionally feel a little discomfort on the upper right abdomen, but often it's not prominent. With further deterioration of the liver health, other things can start to happen, but it's rare that there's much apparent damage until we get to the point of cirrhosis. So one of the important messages here is that we really need to care about what the liver is doing biochemically, using some of these very simple blood tests at the very least, because quite often we don't necessarily have a good way of assessing liver disease through symptoms. So let's see, I think we just go through a couple more questions here. Yes, weight loss can reverse fatty liver disease. And, it's important to recognize that it may not take that much weight loss, but also recognizing that the benefit of weight loss can actually be amplified by eating healthier and by becoming more physically active. There are some points at which, when fibrosis begins to occur in liver disease, the amount of reversibility is much less than before fibrosis occurs. And once cirrhosis is occurring, there's very little we can do to truly reverse liver disease. So in some ways, fatty liver is important because that's the early stage where things are reversible. As far as I know, coffee does not affect the liver. I think it's far more important to worry about these other types of factors that cause liver problems. And I think at this point, based on many, many decades of research, some of which has gone back and forth about the harms or potential benefits of coffee or tea, I think we're pretty safe with a reasonable intake of coffee, recognizing that caffeine, like alcohol, is a drug, but in many ways, unlike alcohol, it doesn't have such an overt harmful effect on the body. There are some really important genetic factors that play into liver disease. And, some of these are very severe. And if you have a particular genetic condition, the liver may never work properly and is at great risk of further deterioration. Other genetic factors may essentially cause a predisposition towards insulin resistance. And in part, that's what we're talking about when we talk about this distinction between Asian populations and populations of African or European ancestry, where the impact of being Asian is essentially a predisposition towards insulin resistance at lower weights. Let's see here. In general, most there's a question about diet and kind of the effects of eggs, avocados, and nuts. Essentially, these are foods that have a fair amount of fat in them. Clearly, plant-based fats are better and really don't have any deleterious impact on the liver. Animal-based fats have a more limited impact than we once thought. It really is things like processed carbohydrates rather than fats who are the real culprit, with the exception of trans fats, which are essentially an artificial man-made fat that is made by adding hydrogen back into an unsaturated fat. But in general, the issue is much more carbohydrates and processed carbohydrates compared to sources of fat. Someone asked about ALT versus AST as two different tests. There are some factors which change how those two tests respond, but in general, they're both responding in parallel, either to worsening inflammation or to improving inflammation. As far as I know, probiotics don't really have much impact on fatty liver. And, if we're talking about more details about diet and reversing fatty liver, it really is combining the quality of the food you eat, trying to eat as healthy as possible, emphasizing fruits, vegetables, and whole grains. And then also the quantity, eating in such a way that the body is either going to maintain an already healthy weight or slowly lose weight over time. And I'm not saying that weight loss is easy. It's really hard, and it's pretty much impossible to do on your own without help and social support. But I think that weight loss is such an important factor in fatty liver disease that we should think about that if we can do it. I think those were most of the questions. Let me just cycle back to a couple more that are in the chat here. There was a question about pregnancy, and there are changes in the liver during pregnancy. A lot of this has to do with that process of recycling the red blood cells. But that's not the same as fatty liver disease. That is, it may look in some respects similar, but it doesn't have the same impact. A couple of questions about menopause and fatty liver disease. And, this is one that's a little hard to sort out, but it's likely that there is some impact of menopause on this whole process of carbohydrate processing. So fatty liver does become more likely after menopause. But on the other hand, as we age, there are other changes that are less abrupt that are going on that also move us in the direction of insulin resistance. So I'm going to wind things up there. I have to say that it's been great to talk with you. And I hope you can get a little excited about thinking about the liver and thinking about these strategies around fatty liver disease. And if you have any questions, I'm available by email. It's rstafford@stanford.edu, and love to hear from you. Thanks so much.